Kborkrn here. We're continuing on how a Salem sump drain works. The sump removes liquids by suction. The sump is important because of the sump part prevents the tube from adhering to the side of the stomach. If this should occur, the suction could cause ulceration, prevents the suction action from working. The sump is the air vent. That's the blue part here. Okay, there's sizes difference, 12 French, 14 French, and 16 French. In placing of a tube, we want to gather the supplies, inform the patient, prepare the supplies, measure. That's from chin to chest. You place it, and then you check their placement with air bolus. And you measure from the ear to the nose down 3 inches past the sternum. You feel the xiphoid process there. You can see that. For the supplies, you're going to have lubricant, a safety pin, silk tape. You're going to tear it like it shows on the right here. A piston syringe, a Salem sump drain, stethoscope, towel, a bucket in case they vomit, and suction setup. When you look at the Salem tube itself, you'll see where the suction part is, the air vent that we've discussed. This keeps the tube from adhering to the side of the stomach. Make sure no liquids are in this tube at any time. That'll add problems to the suction ability. There's a radio opaque marking. You can see it in the light colored line here. The air vent runs down the side of the tube itself. And you're going to have your length markings. And it's measuring for placement, ear to nose, nose to below the xiphoid process. The suction is going to be about 3 inches from the bottom of the tube itself. The air vent is going to be at the bottom of the vent. You will have a tube to prevent fluid from coming back up that air vent, and it's always blue to blue. The blue port will show, the white port is where the air vent is. And we'll demonstrate that on this. Here's the air vent. It comes up and it'll go all the way down through the tube, and as I said, it comes out at the bottom of the tube. And you follow it around here. The air vent is way down at the bottom. The port that goes to the patient is right here. That's hooked to suction. That will follow down, and you can sort of see the radio opaque line here. It's not as descriptive as the other, but this is how a Salem sump works. The supplies you need. Follow me on YouTube. I'll explain more things later. Thank you. Bye-bye.